Now, Christmas and New Year is a time of celebration, but for many it can also be a period of heightened risk when it comes to alcohol. So between Christmas parties, family gatherings and New Year celebrations, the opportunities to indulge in alcohol, of course, plentiful. So multiple studies have shown that levels of unhealthy drinking habits skyrocket during the holiday season. And even those who are moderate drinkers throughout the year can be found giving themselves permission to consume more alcohol during this time of the year. But what are the implications at large? So to discuss this further, Chairperson of the South African Medical Association, Dr. Mvuyisi Mzukwa, joins us virtually to unpack further. Very good morning to you, Doc. Thanks for joining us at this hour.
Good morning to you and good morning to your viewers, and thanks for inviting me.
So we're looking at the truth about spirits, the impact of alcohol and substance abuse during the festive period. What have you observed?
Well, we know at this time, during the festive season in South Africa, alcohol consumption often increases due to celebrations and social gatherings, holiday events. But excessive drinking, as we know, during this time can lead to several dangerous consequences, both individually and also society at large. To just list some of those, you note the increase in road risk of accidents in the roads, what we call road traffic accidents. South Africa, as you know, has one of the highest rates of alcohol-related fatalities. Out of the 1,427 that we've seen in 2023, 1/3 of that is due to alcohol-related incidents. So this is very significant. I mean, if you look at the global picture, we're sitting at around 1 million, around 1 million people dying every year. In fact, 1.2 million every year due to alcohol-related fatalities. But also, there's a spike in driving under influence of alcohol during this time, which obviously lead to these fatal crashes, injuries and fatalities. What we cannot also forget is the violence and assaults. Alcohol would lead to lowering of the inhibitions. People can't control themselves, leading to aggressive behavior and, obviously raised incidents of domestic violence, physical altercations, but also sexual assaults. They tend to rise at this time of the year.
Doc, thank you for painting that picture. Actually, just trying to understand consumer behavior as well and the celebrations that happen over the festive season. We've seen often results in people using alcohol more often and drinking more than they usually do. Talk to us about what you've learnt about the use of alcohol-related behavior, particularly during this period. Why?
Well, at this point in time, there's we tend to experience what we call binge drinking, where people take lots of alcohol, at the same time. It is common during the festive season because obviously these celebrations, but also the availability of alcohol around this time. People have bonuses paid out and all these things. And this leads to obviously what we call alcohol poisoning, where you find that at times it can be fatal. You could die from that if it is untreated. But also, what you also see is the stress and emotional strain that some people face during holidays, including financial pressures, family conflicts, people find themselves in isolation. And they tend to come to alcohol, to obviously find, solutions, which is not actually what we would really encourage, as you know that this is quite a serious problem. But the problem of underage drinking.
Yes.
During this time, underage drinking is often more prevalent, where young people may feel more pressure to drink, whether to fit in their peers or because of lack of supervision during the social gatherings. And this obviously have serious long-term effects on their development and also mental health.
I want to get into your point about alcohol poisoning, because even though alcohol consumption stops, the effects obviously still play out in the body and the brain as well. I wonder if you could speak to recognizing and also preventing or responding to alcohol poisoning if that does occur.
Yeah, what needs to be done, people need to recognize, if the person is struggling, you find that, they may be breathing heavily, they may also be, having their heart rate going faster, but you could see that, the person is in danger. So obviously you would need to take that person to the nearest healthcare facility so that they are attended to. They tend to be dehydrated as well. So that adds to that, including vomiting and stuff like that. So they're losing fluids. So you do need to attend to them. They need immediate medical attention.
There's also the issue of maintaining sobriety, and I wonder if you could speak to that, because for those who are in recovery from alcohol use disorder, the holiday season can be triggering and especially challenging as well in avoiding relapsing. So with festive gatherings, family pressures, normalization of this excessive drinking culture as well during this time in particular, talk to us about mitigating against that or staying steadfast in that moment.
I think at this point in time, we do need to recognize that we have a serious problem of alcohol in our country. And also, like you said, there are people in trouble already who are needing assistance, professional assistance. At this point in time, we do need to take care of them in terms of maybe getting closer to what they are doing, especially our relatives, to have that continuous conversation. But also, we do need to have, contact our healthcare professionals in terms of how we should be, assisting them at this point in time. Like you said, it could lead easily to relapse, and people could find themselves going back because, like I said, there's lots of it at this point in time. But we see also other trends where you find that there are also, women are often at risk during the festive season. Sometimes being used as a means of coercion, manipulation, where people find they buy alcohol for women and then they expect something else in favor or sexual favors in response. But this can lead to incidents of sexual violence and abuse. So there's many factors involved in this thing of alcohol. It perpetuates gender-based violence. It makes, increases the frequency and the severity as well of this gender-based violence. So and this thing is already existing, but it's made worse during the festive season.
Dr. Mvuyisi, it's definitely a societal, broader societal conversation. Delving further into what you've just echoed, what are the signs that you might have a problem with alcohol use?
Well, first of all, if you can't take care of yourself, you will find that, people, they might be not dressed well. Also, they might not, hygienically, they might not be looking good, but also they may be family dysfunctions. Find that it quarrels a lot with family members. Sometimes it doesn't even go to work. It affects the work environment as well. Absenteeism and all these things. And you might find also that there are strained relationships with their colleagues at work. So, and the incidents of crashes in the road. So you might find, all those factors are factors that should point you that, you're not in control. And also those people that are around you should be able to come closer to you and say, but we think that you are not in control because of 1, 2, and 3. And that person may need assistance in terms of being referred to the right healthcare professionals.
I actually wanted to get into that because acknowledging the problem with alcohol can also be challenging in itself, especially in a culture where drinking is normalized. And so if we're looking at the different interventions and the aid available, how does one seek help? What's the importance of also seeking help? But I also want to sift between myths and facts, sobering up myths, sobering up facts as well. Looking after yourself whilst drinking, what advice do you also have on that front?
I think the first thing is, to be safe. Whatever you do, you must be safe. Usually, doing it at home would be a safer environment. And if you are going to be driving, you must make arrangements for that, so that you are not, you don't involve other people, in fact, putting yourself and other people in danger. So there should be transport arrangements around that. But also we must get assistance from the law enforcement agencies, to make sure that they are available, they are seen on the road, so that people they may be that may be prevent incidents where people are driving while they are drunk. So those interventions are very critical. But also family members. This thing of controlling alcohol is not a government problem. It is our problem. It is eating a lot in the budget of the healthcare department in South Africa. There's lots of money that goes to alcohol. There was an intervention, or should I say, during the times of COVID, we could also see what the impact of alcohol and when there's no alcohol in society. I mean, there was a time when casualties were empty, simply because there was no alcohol in communities during lockdown. So those things are very critical. I'm not saying there must be nothing with communities, but we do need that cooperation, that working together, so that we curb these fatalities and the violence and also the wastage that goes into the healthcare facilities.
Yes, because there are short-term consequences and there are also long-term consequences. And so I wonder, whilst you've spoken about typical behavior and patterns and trends emerging during this festive season, there are also long-term implications for those who abuse the substance. So talk to us a little bit more about that. But also, again, as you mentioned, it's not just up to government. All of us should play a role, doctors included, in terms of spreading that awareness. What are some of those long-term risk factors that one has to also consider if you're going to be abusing it at large?
Well, I like your question because there are long-term alcohol abuse implications. They could exacerbate, liver disease, heart problems, mental conditions as well. The festive season may also see more people engaging in heavy drinking, contributing to health long-term complications. Sometimes people forget that they are taking a chronic medication. When they do forget, their conditions are made worse. Let's say, for example, a person who is taking medication for diabetes. They may forget that they are taking medication for diabetes, and what could happen is that you could have acute complications due to that event, and that person could be admitted in ICU or even could face fatality. We do need to be careful around this time, to assist our family members, but also remind ourselves that is just only this season. We should be controlling ourselves. We should be behaving in a manner that we think about long-term complications on the issue as well. But also, there are issues of mental health as well. Because sometimes after things have happened, there are implications. You find that you're already having family problems, that are not going to be resolved on a go. They need interventions from the psychologist or whoever, but also gathering of families, to resolve some of these conflicts. So it has huge implications to the individual, but to society as well, yes. Including the workplace.
Yeah, absolutely. Well, we're hoping to see whether the devastating facts that usually come about this time around due to the consequences of substance abuse is going to be lower this time around for the benefit of all. But let's leave the conversation there for now. Dr. Mvuyisi Mzukwa, Chairperson of South African Medical Association, SAMA, joining us this morning virtually and chatting about alcohol abuse this festive season, some separating between myths and facts as well, and also just how to enjoy responsibly. So again, thank you to him for joining us at this hour.